were extremely crooked, and whenever I talked to anybody, I would want to talk like this.
Americans spend $60 billion a year on dental care. From vaccines that prevent cavities to braces you can remove when you eat, kids and kids at heart are benefiting from new procedures, giving them something to smile about. Her smile may be the most famous on earth, but Mona Lisa's closed-mouth grin does little to reveal what she may have been thinking, or what lies behind her lips. Today, there is less mystery to a dazzling and healthy smile, and what we need to do to get one.
Time to brush your teeth, sweet.
It starts here.
No, you don't need to brush the wall.
Toothbrushing is one of the first tasks children learn.
Oh, that's your face. Brush your teeth.
And maybe one of the most important. Researchers know that cavities are caused by bacteria.
These organisms colonize the tooth surface between a year and a half to 3 years of age.
They're testing a vaccine they say can stop it.
This would be a very effective means of combating this really painful and costly infectious disease in populations worldwide.
There seem to be fewer numbers of these bacteria.
The vaccine would not replace brushing and trips to the dentist, but can give kids better protection. Ironically, the way we brush our teeth may lead to problems as we get older.
Yeah, there's one here, and one here, and one there.
Howard Joyner was surprised to find out his gums had receded so far, notches formed. The upper part of his teeth were exposed.
I was not aware of it at all.
Typically, a filling material is used to cover the exposed areas, and holes are drilled to hold the material in place. But Howard underwent a new procedure, where the tooth is primed instead of drilled, and then an adhesive is applied. It's cured with a high-intensity blue light. The filling material is then applied.
By being able to bond a restoration or a filling on a tooth without any type of drilling, we will be conserving the tooth structure.
The area that was once exposed is now protected from decay. Cosmetics drove Adrienne DiStefano to seek treatment, a treatment once reserved for kids.
My two front teeth next to my big front teeth were overlapping, and this bottom tooth was laying almost on its side. On a job interview or, for whatever reason I would be trying to impress anyone, I would try and hide my teeth.
But the idea of metal was not appealing.
I know a lot of different people that have had braces growing up, and they were always cutting their inside of their mouth.
There are many choices for adults who want to change their smile discreetly.
One type of brace is an invisible brace where it's fastened to the tongue side of the tooth. They're called lingualized braces or invisible braces.
There are also ceramic or plastic braces.
They can blend in with your teeth, so they're just like our traditional metal braces, except they're tooth color.
And there is the method Adrienne chose. She wears clear aligners, custom made for her teeth.
It's amazing how this computer technology can take a simple impression and generate where your smile is going to be 6 months down the line.
You can watch how this tooth is pulled down.
The computer shows movement of the teeth in 2-week segments. The manufacturer uses these models to create a series of clear trays the patient wears at 2-week intervals.
The patient wears each aligner, and slowly the teeth are moved into the position, the final position.
Patients remove the braces when they eat.
You're able to floss and brush like you normally do, so you can keep that healthier gums.
But orthodontists don't recommend removable braces for children under the age of 14.
It's a compliance problem. They have to make sure that they wear the trays.
And while most adults have a cosmetic goal, there is a medical benefit.
Straight teeth are healthy teeth. They're easier to keep clean. The bone support surrounding them is more intact, so they'll last longer.
And an emotional one.
I get a lot more confident. It just makes me feel good.
Removable braces cost between $5,000 and $8,000, about the same as other types of braces. They're not recommended for patients who need jaw movement.